California announced today the state will be setting aside 40% of all vaccines for people living in the most vulnerable neighborhoods. Action News Now reporter Amy Lansky spoke to Shasta County's Carrie Schutte about how they will be helping people of lower incomes.
The state says the reason for this is to vaccinate the people who are most at risk quicker, and then the state can actually open up faster. The doses will be spread out amongst 400 zip codes, mainly in Los Angeles County and the Central Valley. It'll cover about 8 million people. Those areas are considered the most vulnerable based on metrics like household income, education level, housing status, and access to transportation. Carrie Schutte from Shasta Health says that she's not sure if the county will be included, but they'll still follow the state's suggestions.
No, it doesn't change anything about the tier system. There are still those groups that are eligible now, and then the groups that will be eligible later, and that doesn't change at all. It just helps make sure that that of those groups, we are reaching out to all of them equally.
Schutte says in Shasta County, they are doing outreach to vulnerable populations to make sure they know when they're eligible. And data shows that of the shots given, only about 17% were administered to those vulnerable communities, which have disproportionately been affected by the pandemic. Live in Chico, Amy Lansky, Action News Now, coverage you can count on.
Thank you, Amy. According to California's Dr. Mark Ghaly, setting aside 40% of vaccine supply essentially means that hard-hit zip codes will be administering double what they are currently.